Complications of AIDS. Here are the most important complications that can be caused by AIDS infection. 1. Inflammation, infection. Inflammation caused by the AIDS virus weakens the immune system, making a person who is a carrier of the AIDS virus vulnerable to many infectious diseases caused by germs, viruses, fungi, or parasites. The body also becomes susceptible to certain types of cancer, but the treatment of AIDS with antiretroviral drugs has significantly reduced the number of opportunistic infections and various types of cancer that attack patients infected with the AIDS virus. It can be assumed that these infections will appear in people who have not received any treatment. They include the following. Bacterial infections. Bacterial infections. There are many germs that can lead to bacterial pneumonia, which can arise spontaneously due to contamination of the lung itself or as a result of inflammation of the upper respiratory tract due to cold or flu. Avian Mycobacterium complex, Mycobacterium avium complex MAC. It is an inflammation caused by a group of microflora. These bacteria usually cause inflammation of the respiratory tract, but if AIDS has reached its advanced stages and the T lymphocyte count has dropped below 50, it is more likely to arise multisystem inflammation capable of infecting almost any internal organ of the body, including the bone marrow, liver, spleen. This inflammation causes a set of symptoms, such as high body temperature, night sweats, weight loss, abdominal pain, diarrhea. Tuberculosis, tuberculosis TB. Tuberculosis in developing countries is the most widespread opportunistic infection associated with HIV infection, and tuberculosis is the leading cause of death among AIDS patients. Millions of people around the world are infected with both AIDS and tuberculosis, and many experts consider the two infections as twin epidemics, because there is a deadly symbiotic relationship between AIDS and tuberculosis, as each stimulates the emergence of the other. A person with AIDS is more susceptible to tuberculosis infection, and the risk of transmission of his AIDS virus from a dormant virus to an active virus increases. Tuberculosis also increases the frequency and rate of reproduction of the AIDS virus, not to mention that tuberculosis may attack people infected with the AIDS virus many years before the appearance of any symptoms that would indicate infection with the AIDS virus, as the sudden appearance of tuberculosis outside the lungs is often one of the initial symptoms of AIDS infection. If the tests show that a person carries the AIDS virus, then it is recommended to immediately undergo a TB screening test, and if the result of the TB test is positive, then an imaging of the lungs and other necessary tests are recommended to detect whether tuberculosis is dormant or active. If the disease is ineffective, there are several medical treatments that will prevent the disease from turning into an effective disease, as tuberculosis is a disease of greater concern and more severe than other opportunistic diseases due to being a very contagious disease. Inflammation of the intestine caused by Salmonella bacteria, Salmonella. This infectious inflammatory disease is transmitted through contaminated water or food, the symptoms of which include severe diarrhea, high body temperature, chills, abdominal pain and sometimes vomiting. Although everyone who is exposed to Salmonella bacteria gets sick, it is more common in carriers of the AIDS virus, where it is possible to reduce the risk of contracting the disease by washing hands thoroughly after contact with food or animals, and paying attention to cooking meat and eggs as it should. 2. Viral infections, which include the following. Cytomegalovirus, CMV. This is a common virus that causes herpes, as it is transmitted mainly through body fluids, such as saliva, blood, semen, and breast milk. A healthy immune system can neutralize this virus, turning it into an inactive virus in the body, but when the immune system is weak, the virus becomes active and may cause damage to the eyes, digestive tract, lungs, and other organs of the body. This virus causes infections in the retina of the eye, and if such inflammation in the eye is not treated, it can worsen to the point of total blindness. Viral hepatitis. Symptoms of viral hepatitis include yellowing of the whites of the eyes, i.e. jaundice, fatigue, nausea, abdominal pain, loss of appetite and diarrhea. There are several types of viral hepatitis. Hepatitis of the two types viral hepatitis B and viral hepatitis C may lead to chronic and persistent inflammation, which increases the risk of developing long-term complications, such as cirrhosis or cirrhosis of the liver, liver cancer. If a person carries the AIDS virus and has contracted viral hepatitis, then he may be at risk of future liver poisoning as a result of the medications he will have to take to treat that disease. Herpes simplex virus, HSV. The herpes simplex virus that causes the appearance of herpes in the genitals is most often transmitted when having unprotected anal or oral sex. The initial symptoms of this disease include pain or irritation and itching in the genital areas. Later blisters with fluid that burst and bleed appear in the genital areas, the butt, and around the anus. Although these wounds usually heal on their own, the virus reappears periodically, causing the same symptoms over and over again. If someone is a carrier of the AIDS virus, the skin inflammation caused by the herpes simplex virus is likely to be more severe and dangerous than it can be in healthy people, and it may sometimes take longer for the wound to heal. His general herpes symptoms are also likely to be more serious, as although herpes is a disease that is not life-threatening, in serious cases it can lead to blindness or brain damage. Human papillomavirus. Human papillomavirus. This virus is one of the most widespread viruses among sexually transmitted viruses. Some types of this virus cause the appearance of simple warts, and other types of it may cause the appearance of warts in the genital area. If a person is a carrier of the AIDS virus, he is more likely to get an infection caused by the papillomavirus, in addition to an increased likelihood of getting frequent infections caused by this virus. Inflammation caused by the papillomavirus poses a particularly great danger to women because it increases the likelihood of developing cervical cancer. The combination of HIV and HPV together significantly increases the degree of risk in women, since cervical cancer has been found to attack women who are carriers of the AIDS virus more seriously and lethally. In 2006, the U.S. Food and Drug Administration approved for the first time the use of a vaccine against the most dangerous types of papillomavirus. This vaccine has been shown to be effective mainly when given to girls before they start having sexual relations, but it is also effective for young women up to the age of 26 who have regular sexual relations. If this vaccine is not suitable for a woman who is HIV positive or has unprotected sexual relations with a large number of partners, it is preferable to undergo a cervical cancer screening test called Papa-Nicolau test. Papa-Nicolau test. Once a year. In this test, cells taken from the cervix are examined in order to exclude the possibility of cervical cancer, papilloma or other sexually transmitted diseases. Every man who has anal sex is recommended to undergo a special examination to detect cancer in the anus, since the papillomavirus increases the risk of developing this cancer in both men and women alike. Progressive multifocal leukoencephalopathy, PML, progressive multifocal leukoencephalopathy. Viral encephalitis is an acute inflammation caused by the human oncovirus of the John Cunningham virus type, JCV John Cunningham virus. The symptoms and initial signs of the disease vary from case to case, and include difficulties in speaking, weakness on one side of the body, loss of vision in one or both eyes, or loss of sensation in one limb. As for viral meningitis, it appears only when the immune system is significantly damaged.